Good morning, everyone, and thank you for joining us today. As you'll be aware, today is Time to Talk Day, which is an event that's hosted by Time to Change. The aim of Time to Talk Day is to have over 1 million conversations about mental health, with a focus on removing the stigma that's still associated with talking about mental health, which obviously includes in the workplace. So moving on to the next slide, we'd just like to say thank you very much for joining us today and contributing to the 1 million conversations. By participating in our webinar, lots of you already submitted questions, so we're really excited that we can contribute so much to Time to Talk Day. So moving on, just to recap why we think this is so important. The statistics on the number of people experiencing mental health issues shows just how commonplace it is, and yet it still isn't talked about as openly as physical health conditions. And yet, sometimes it's as simple as asking, how are you? I'm joined today by Dr Mark Winwood, who's Psychological Services Director for AXA PPP Healthcare, who's ready to answer questions that many of you have already been submitting around how to talk about mental health in the workplace. Lucy is going to be asking Mark the questions that you've already submitted, but please do use the form on the left-hand side of the page if you want to ask any questions as we go throughout, and we'll try and answer as many of them as we can at the end. So I'll now hand over to Mark and to Lucy.
Thank you, Becky. So, Mark, I suppose the first question is to ask, what do we actually mean by the term mental health?
Okay, well, that's a great question to start with, actually. What I'd like to say is each one of these questions today is going to count as one conversation. So the more questions we can get through, the more questions we're going to be taking off that million, which is obviously the aim for today. And I'm really, really pleased that we can be part of this. Okay, so mental health. Today is about talking about mental health. Now, what is mental health? Well, we all have it. We all have mental health as we all have physical health. Yet we feel far more comfortable having a chat at the water fountain in the office about our sniffly nose and our chesty cough, but we're less likely to talk about our feeling sad or feeling low or having some problems that could be psychological in nature. So I believe our state of mental health at any given time can be positioned almost along a continuum. It's a line. At one end of this continuum are those with mental health conditions that have been diagnosed by a clinician, which can include severe problems such as anxiety, depression, and when I talk about depression, I mean those with unipolar or standard depression, if you like, and also those with bipolar, which is sort of what used to be called manic depression. Those with substance use problems and addiction disorders, those with eating disorders, etc., those with schizophrenia, I'd see at one end of this continuum. However, at the other end are those problems what we refer to as problems of everyday living, such as trying to fit in too many things into the day and not prioritizing, which obviously causes excess pressures. We all have occasional sleep problems due to excessive worry, too much caffeine or too much alcohol, or just not having a great sleep routine as you're dealing with young kids or flying across different time zones. These are problems that we all have to juggle with, but actually do have an impact on our mental health. So they would be sort of lower end, if you like, on this continuum. Sometimes, however, these problems of everyday living, which I've just alluded to, can escalate into more serious problems if left unchecked. Using the analogy to physical health, it's just like eating fast food for a protected period of time. It'll have an impact on your cardiovascular system and your weight. Not taking time out to relax will increase your feelings of pressure, which can lead you to feel that demands that you put upon yourself are greater than your ability to deal with them, which can lead to stress and on to anxiety disorders. So when we talk about mental health, I really want us to highlight that we are talking about this continuum.
Okay, thank you, Mark. That's a great context around what we're talking about today. So how common an issue is mental ill health within the workplace?
Okay, well, I think Becky's already shared some statistics with us, and there are statistics everywhere. 1 in 4 people will experience a mental health problem in any given year, and 1 in 6 will experience a mental health problem at any given time. So if you put that into context, in in a company of around 60 people, 10 people could potentially be struggling from mental health difficulties such as anxiety and such as stress. I think current economic pressures can't be ignored, and this means that all businesses are under increased pressure to meet targets, and employees, rightly, are fearful of losing their jobs, and along with their jobs, their livelihoods. This inevitably adds an increased layer of pressure within the workplace, which may have not been present before, or not present in such a high degree. I think the media reporting of mental health issues in the workplace is also on the rise. We read about it lots more. This obviously is helping raise awareness, which is what we want to do, and that's what today is all about. So it raises awareness among employees and encourages employees to speak up about their issues and the issues that are causing them, in particular stresses and anxieties within the workplace. I think the statistics that are out there that are used, are based on the UK population as a whole, and there are certain groups of people who will be excluded from the workplace population by virtue of their mental health condition. If they have some enduring long-term mental health condition, they may well not be in the workplace, for example. But even so, I think those statistics of 1 in 4 are pretty accurate in terms of what we're seeing. If we look at it more broadly, depression, in any given year, about 3% of our whole population experience depression. Anxiety is higher, actually. About 5% of people will be experiencing anxiety in any one given year. Nearly 10% of people experience a mixture of anxiety and depression, which on the whole is the most common presentation of mental health disorders, to be honest with you, is a mixture. But yeah, they're the statistics as they stand. But we must treat statistics very carefully, treat them with respect.
Thank you, Mark. So mental health conditions then are fairly common.
Yeah.
Can people function properly at work when they do have a mental health issue?
That's quite a hard question to answer in a very, very general way. I'll do my best. Okay, if an employee has experienced a significant episode of mental ill health, then I would say it'd be probably impossible for that employee to function normally at work, whatever normal is, or properly at work, as they would without that mental health condition. However, if that same employee was getting appropriate treatment for that condition, and the workplace could demonstrate some support, then it would be completely possible, I'd have thought. That's the sort of most general way I can respond to that. However, in order for this to happen, a number of things need to be put into place. Access to appropriate help is absolutely imperative. And if necessary, adjustments need to occur in the workplace so they can get the necessary help that they need to access. So, for example, if they need to access certain therapies, time off from work needs to be accommodated, or their hours might need to be adjusted in order for them to take certain treatments, or because of the particular condition they're experiencing. It's really helpful as well if there's a culture in the workplace that doesn't discriminate. I keep saying that today because that's what today is about. So acceptance in the workplace, again, is something that's really important to help people who might be experiencing significant mental health problems to actually be part of the workforce. Even if someone has a diagnosed anxiety or depression at work, work in itself can provide positive input into that person's life. On the whole, I really do agree and believe that work is good for us. Work's a good thing. Avoiding work can contribute to the maintenance of a mental health problem. Avoidance from the thing that might be causing stress is not always a good way to treat that stress in the long term. So avoidance may not be good. People who are experiencing, I think, or who have experienced a mental health problem can be better and more productive workers than those who haven't, strangely. As on their journey, they've probably learned some really important life lessons that makes them far more resilient in the workplace and colleagues who perhaps have not had the same experience. So actually, there could be actually a really positive outcome for people who've experienced mental health problems to be in the workplace because of that added layer of resilience and self-knowledge they have.
Okay, thank you, Mark. We've had a few questions around the same area for the next question. So if I'm a manager and I manage a large team, how can I tell, if someone's working hard under pressure? What are the symptoms I should look for that someone isn't doing so well?
Okay, so the signs and symptoms of someone who might not be coping.
Yeah. Okay.
Well, I think I'd break this down really into sort of three clusters of symptoms that we can look out for that demonstrate that people perhaps aren't coping particularly well for whatever reason.
Yeah.
I think there are psychological symptoms that we can notice, and those include recognizing that someone might be in a continuous low mood or demonstrating quite a high degree of sadness. They might describe feeling hopeless or useless, which can actually demonstrate that they're perhaps experiencing issues with their self-esteem, and their self-esteem may be reduced for some reason. They might be tearful. They might be talking about feeling guilty quite a lot. On the other hand, they might be demonstrating irritability. They might be demonstrating intolerance with other people and colleagues, where before they'd be quite tolerant. So you may notice a change in their level of tolerance. They may have little motivation, so their motivation may have changed. Their performance may have declined because of that motivation. They might find it difficult making decisions. They might find it difficult to concentrate on particular tasks. They may demonstrate anxiety or worries, or constantly looking anxious and worried and saying that they're worried about things a lot. But on the extremes, they may also talk about feelings of not wanting to be around and quite serious suicidal feelings. So they're the sort of, if you like, psychological signs and symptoms that we can all look out for in our colleagues and our team members, which might demonstrate that stresses or pressures in the workplace might be getting too much and they might not be coping. The sort of physical symptoms that you might notice, so this is the next cluster of symptoms, if you like, are things like the individual might be moving more slowly or speaking more slowly than usual. You might notice a change in their appetite. They may be losing weight, or they may be gaining weight. So they might be eating lots more. They might talk about having aches and pains that for no apparent reason, or talking about aches and pains a lot. They may have disturbed sleep, so they might look quite tired, and they might appear quite tired, and might complain of not being able to get to sleep at night, or waking up very early in the morning, or not being able to stay asleep, or not being able to get out of bed because they want to sleep all the time, or sleeping all weekend, so changing again to sleep. They might be more aggressive or more passive. Again, changes in their levels of aggressivity is the wrong word, isn't it? I don't know what I'm trying to say there. Their levels of aggression. Okay, I'll leave it there. But also, there's another cluster. The final cluster I'll go into is quite a long answer, isn't it? Are sort of the more social symptoms. So you might notice changes in performance at work, not doing quite so well at work, not going out with people at work on Friday nights if that's the sort of normal behaviour. So not taking part in all of the social activities that work might offer, not having the chats in the coffee room or around the water fountain or wherever you have your chats in the canteen, etc., etc. You might notice that they've neglected hobbies. If they're very keen anglers, all of a sudden they're not talking about what fish they caught at the weekend, or various other things that they might have shown lots of interest in before and brought into the workplace. They may, demonstrate having difficulties or talk about difficulties at home as well, or home in their family life. You know what? The thing is, though, all of these things can creep on quite gradually, and so it can be difficult to notice that something is wrong because things change quite slowly over time. And many people try continually to cope with their symptoms without realising they're even ill. It can take a friend, a colleague, a manager, or a family member to suggest that something is wrong, to be honest with you. So, this is where managers can really come into their own. If you are noticing over time that someone has changed, this may be the conversation or maybe the time for someone to notice that things are going wrong, aren't going so well for them. It's really important to address this with a member of staff if you do notice these things. But it's also important for you to get support as a manager if you find it difficult to raise this subject. Please don't assume you have all the answers. Ask if the individual is ready to get help for themselves. Think about what might help at work. Would a referral to the EAP or the Occupational Health Department be appropriate? It's really important to try and manage the situation as sensitively as you possibly can. And I don't want to go into more detail of that now because I can see questions coming up, and I think we might have more questions on how to broach these subjects later. So I'll answer that if we get round to it. Thank you.
Mark. Thanks. So we've got psychological, physical and social symptoms there. When it comes to the interventions, how do you tell the difference between someone who could be mentally stronger through self-help or low-risk interventions and when things are more serious and cause mental ill health?
Okay. God, that's a long question. What I would say is to answer this, if ordinarily, would be that a good assessment of an individual's symptoms, circumstances, history, needs, the list is endless, are essential to help decide what sort of intervention might best help. And that's usually done by a clinician or a mental health practitioner. So I'd never expect any line manager or HR professional to make an accurate assessment of this, to be honest with you. However, a good manager should direct any individual they understand or they believe might be struggling to a good quality source of support. And with that, I mean their GP. I mean their employee assistance program if they have one. I mean their occupational health department in order to make an accurate assessment of what will best help that individual and whether a low-level intervention is more appropriate or whether something more robust or complex is more necessary to treat that individual. I think by organisations promoting things like time to change, time to talk, the Stronger Minds campaign that AXA PPP has promoted at the back end of last year. These initiatives and similar schemes, if they can be promoted, all employees have the opportunity to make some assessments of their own well-being, and then they can direct themselves to the correct level of support. So good promotion and acceptance of these sorts of initiatives can be really, really helpful, and then everyone can benefit regardless of their current state of mental health or mental well-being, really.
Thanks, Mark. So you mentioned about an employee assistance program or occupational health team. Could you go into a few more strategies that are available to people without using medication?
Well, gosh, okay. There's lots of things that are available for people to try, for people to get treatments that don't include medication. And the internet is full of them. I'd obviously, recommend caution when going to the internet and use recognised sites only. But I suppose the most common strategy that can be helpful for people experiencing problems with anxiety or depression that doesn't involve medication would be what is commonly known as talking therapies. Now, talking therapies are really what they say on the tin, and these can be delivered traditionally face-to-face, as Professor Freud did it back in God knows when. But more recently, they can also be delivered, certain ones of them anyway, over the telephone, via Skype, online, via emails, via specialist programs, via live chats. Actually, the way that therapies can now be delivered are growing in at the same rate as our ability to communicate in different modalities is growing. On the whole, however, what do talking therapies have in common? They provide a regular time and space for people to talk about their troubles, explore difficult feelings with a trained professional. And these can help deal with specific problems, cope with the crisis, improve your relationships, or develop better ways of living, basically. Usually, these sessions are spaced out at regular intervals, sometimes weekly, sometimes every other week, sometimes more often, really depending on the problem. And, these therapies are commonly referred to as psychotherapy, counselling, therapy, but they all basically mean the same. They all basically mean they're talking therapies. And talking therapies can be delivered by specially trained mental health professionals, and these can be called counsellors, psychotherapists, they can be called psychologists, they can be called psychiatrists, and they can really, help people dealing with a whole range of difficulties. We've talked about stress, we've talked about anxiety, but we can talk about low self-esteem, anger, fear, sadness, guilt, phobias, more serious issues such as obsessive compulsive disorders, psychotic disorders such as schizophrenia, paranoia, bipolar disorder, and there's a whole range of them. I'm not going to go into all of them because at the last count there's about 600, but the more common ones that are used and have been given and shown the best evidence are therapies such as cognitive behaviour therapy, such as cognitive analytic therapy, such as person-centred therapy, such as systemic therapy, which is commonly used by family therapists in dealing with groups of people. But I could go on, but there's loads more questions, so I better stop there. But as I say, the most common treatment that doesn't involve medication is talking therapies.
Thank you, Mark. That leads me nicely on actually to the next question. So the purpose of today is around helping to remove the stigma and talking about mental health. So as a line manager or an HR professional, how can I encourage my teams to talk more openly about mental health?
Well, I think you have to model the behaviour you want to promote. And I think the best way to do that, if you like, is to be open and talk about it yourself with your teams. It's very much the best way to reduce stigma. I'll keep saying that. I've got the message here. And what today is all about is to be open to mental health in the same way as we are to physical health. That's the mantra of today. Bring up mental well-being at your team meetings. Advertise, promote mental well-being initiatives. That's the best way to look after your people, the best way to get it out there and be open about it. You can also, elect mental health first aiders in your teams or have mental health champions. We all have, in our offices, we have first aiders. Why not have a mental health champion or a mental health first aider? And these people can be the go-to people to promote mental health awareness initiatives, for example, to promote what's going on in your EAP, to stick up the posters, to have, all the cards with the EAP number on it. To have the Samaritan's number if necessary. Have a bit of a go-to person to do that. Just one suggestion, really. And encourage your team. Give them time to go and attend wellbeing seminars that are being offered. Or even set some up yourself. Set up, a team day or a team lunch, specifically looking at these sort of mental health issues and initiatives that are there to support people.
Thanks, Mark. We've got a similar question, actually.
Hi.
So as well as promoting talking more openly about mental health, what can I do as a manager to promote mental health and as well resilience?
Oh, okay. Well, organisations offer services to employees, don't they? That's one of the reasons we all go and join organisations, to get some of the benefits. And a lot of these are to promote good physical health. So we have gym membership schemes, fantastic, cycle to work schemes, which is particularly useful if you're living in London at the moment and trying to get about. We could also promote good mental health services in a very similar way. So, promote an EAP service, online wellbeing portals, targeted coaching, awareness and training, promoting the advantages of mentally healthy lifestyles in the same way as we do promote physically well lifestyles. again, this is what it's about. There's a huge amount of stigma associated with, coming out, if you like, as having an issue with your mental health. A lot of high-profile individuals have been brave in recent months and disclosed they have a mental health condition. This really helps break down this stigma and promotes the concept of managing your mental well-being as a professional requirement, as something that's really, really important. However, there is still such a long way to go. And on the whole, research tells us that people, and professionals in particular, are uncomfortable or unwilling to disclose their psychological concerns at work for fear of discrimination or for fear of things like being looked over for promotion. Threats against job security really feed into this fear. So signing things, this is promotion now for time to change, signing things like the Time to Change pledge, really tells their organisation that they're supportive of breaking down the stigma associated with mental health. That's a really good way of promoting mental health as an issue within your organisation by signing up to these sorts of initiatives. Other ways would be to promote stress awareness weeks, depression weeks, etc., to keep the concept of good mental health at the forefront of everyone's mind. And being a manager, being a strong manager, would be to promote these sorts of initiatives. It's breaking down discrimination, breaking down stigma, and most of all, breaking down fear. If you're brave enough to talk about it, so will your team.
Great, thank you, Mark. You talked earlier about 3 different types of symptoms, and we've got a specific question here on one of the physical symptoms. So the question is, sleep problems are common in my organisation. Is there anything I can suggest to my teams that would help them with that?
Okay. Many of the effects, of having a bad night's sleep, such as feeling grumpy, not working your best, are really well known. I'm really glad this question's come up. Actually, it's one of my things, sleep. We know those facts, but sleep, deprivation can also have a really, really profound consequence on your mental health. So it's great that question's come up. 1 in 3 Britons suffer from poor sleep, with stress, taking work home, not being able to switch your computer off, often blamed for the lack of quality sleep. When we've done some work on this ourselves, and as an EAP provider, we found that 76% of callers into our own EAP requesting psychological support were experiencing sleep problems. So it's a really, really big issue. Given that a single sleepless night can make you irritable and moody the following day, it's not surprising that chronic sleep debt may lead to long-term mood disorders like depression and anxiety. Is it really? Not at all surprising. When people with anxiety or depression have been surveyed, for example, and they've calculated their sleeping habits, it turned out that most of them slept for less than 6 hours a night. So, there is a real link between low levels of sleep and mental health issues. Some organisations are now employing sleep coaches and making programs available that specifically tackle sleep problems, insomnia, and promote good sleep hygiene to address this issue specifically. Because they see a real benefit to the bottom line of having staff who are not sleep deprived, because there is this relationship between sleep deprivation, mental ill health, but also poor decision making and other things that come along with it. And they're more likely, a sleep deprived workforce are more likely to make mistakes and have accidents, and as I've already said, make poor decisions. So it's not going to be good for an organisation on the whole. I could go into sort of quite a few tips here and now on how to promote good sleep, but I think I'd rather direct everyone on the call actually to AXA PPP's website, because I think there's already quite a lot of information on sleep that we've put together there, and it also has a tool, a sleep diary for people to use so they can monitor their own sleep, because a really good way of trying to understand your sleep patterns and the problems you're having with sleep is to actually keep a diary of your sleeping pattern by keeping a diary, you can find out what's working well and what's working less well in your quest for good sleep. Also on the website, you could be directed towards a specific tool which uses cognitive behavior therapy, or specifically CBTI, which is cognitive behavior therapy insomnia, as an online program to help people who do have significant problems with sleep. This particular program is called Sleepio, and it's available via the AXA PPP website. And if you don't have access to that for whatever reason, it's also available at Boots online. So again, that's another really good resource which can help people who are experiencing sleep problems.
Great, thank you, Mark. We've had a message come through on our Twitter account at AXA PPP Business asking, are there any online sources of support for the management community? Okay.
There's lots of as I said earlier, there's so much online information that says this is helpful for managers, or there's so much online information about signs and symptoms of mental health problems. I think information online can be really, really useful. It can also be really, really problematic if the information that's being given is incorrect for whatever reason. And so I'd always direct people towards what I'd call the quality resources when it comes to online information and resources. When I talk about quality, I'll sort of list out a few of the ones that I think are particularly useful, and I think the content is of a high quality that you can rely on, which is most important. Mind's website, for example, is extremely good, especially because it talks about mental health in very, very easy to understand terms, and I think that's really useful not only for managers who are trying to understand the impact of mental health problems, but also for people themselves who might be experiencing some signs and symptoms that would like to get some support around. Anxiety UK again says what it says on the tin. It's for people who are experiencing some of the anxiety disorders, and as I said earlier, they tend to be the more common, one of the more common problems that are being experienced now, with about 5% of the population in any 1 year experiencing symptoms of anxiety. But yeah, a very good source of resource. The CIPD is great to access information specifically for HR and managers community. I know that AXA PPP Healthcare provide quite a lot of content specifically from an occupational health and psychological health perspective to the CIPD. So again, I'd vouch for the information that's on there as well. So again, another good resource. I think I've already blown our own trumpet, but AXA PPP Healthcare's website is also a damn good source of support.
Absolutely.
Yeah. The NHS, can't go wrong. NHS website, again, gives good sources of support, but also, gives good direction in where people might go and a good outline in what sorts of services the NHS can offer to help support individuals and support people. Increasingly, the NHS are trying to increase access to psychological therapies for individuals. As always, the NHS has limited resources, and it can be a bit of a postcode lottery. But the general desire, the general goal for the NHS is to provide good quality, evidence-based psychological support for everyone in the UK. And so, again, the NHS can be a great source of online support as well. The Royal College of Psychiatry, again, what it says on the tin, this is probably what I'd call information of a more complex nature. Then again, extremely, extremely good. Again, they have lots and lots of downloadable resources to give to people who perhaps have diagnosable conditions. So if someone comes to you and says, I've been diagnosed with schizophrenia, or I've been diagnosed with bipolar disorder, or I've been diagnosed with obsessive-compulsive disorder, they'll have a downloadable help resource to give to someone who might need it, or useful for you to read, so you understand the sort of problems that your particular employee might be experiencing. That's great for download, so I'd go there. The British Psychological Society, again, great source of support. And the British Association of Counselling and Psychotherapy, again, the BACP, that's a good source of support. Time for Change, I'm not going to go by without advertising their website as well. It's what today is all about. So, again, has another good source of support, of resource. So there's lots out there. There really is lots out there. But, again, I can't say it loudly enough. Please be careful where you go for this information. The ones I've just mentioned are good.
Okay, great. Thank you, Mark. So over the course of today, so far, we've mentioned quite a few terms that are used when we're talking about mental health. What is the difference between someone saying that they are depressed and clinical depression?
Oh, okay. Most people experience, I suppose, what we call ups and downs, don't they, in their life? And during difficult times can feel unhappy, depressed, stressed, anxious. These are just normal feelings. They're normal everyday life experiences. Problems of everyday living. Many difficult events and experiences can leave us in low spirits or cause depression, relationship problems, bereavement, stress at work, bullying, pain, illness. Changes to hormones during puberty. So if you've got, teenage children at home, you might be seeing a bit of that. You can feel low after childbirth. The menopause can also have an effect on your emotional and mental health. However, sometimes it's possible to feel down without there being an obvious reason. So, that is probably the biggest difference. So a low mood, so someone who's saying, they're feeling a bit depressed, can include sadness, feelings of anxiety, worry, tiredness, low self-esteem, frustration, anger. However, a low mood or a bit of depression, non-diagnosable clinical depression, tends to improve after a short time. I'm not saying you don't need any help for it, but it does tend to improve over a short amount of time after a small amount of assistance. Making some small change in your life, like talking about your problems or resolving a difficult situation, getting more sleep, all the things I've been talking about, can improve your mood. Okay? Now, a low mood that doesn't go away after those sort of interventions can be a sign of what we call clinical depression or depressive illness. Symptoms of depression are a bit different. They're more severe. And these will include continuous low mood or sadness over a period of a number of weeks. Feeling of hopelessness and helplessness. Having low self-esteem. Feeling tearful over a prolonged period of time. Feeling guilt-ridden. Feeling irritable and intolerant of others. This list might sound similar because I've gone through it before today already. Having no motivation or interest in things that you used to have interest in. That's called ahedonia. It's where the things that used to make you happy, make you hedonic, no longer do. Finding it difficult to make decisions, decisional paralysis. Getting no enjoyment out of life. Having suicidal thoughts or worrying thoughts about harming yourself and feeling constantly anxious or worried. So there is a distinct difference between low mood and being blue and having depressive illness. There are two distinct things.
Okay.
But again, a longer continuum, the continuum I talked about in the first question. Someone with depression, if you think about continuum from a left to a right with left, very little sadness or low mood, to the right with depression. Low mood is at the left-hand side of our spectrum, if you like. Clinical depression will be on the right-hand side.
Okay, thank you. So the title for today's webinar is Let's Talk About Mental Health and about being open. So we've had a great question here. How do I ask someone, whether they're a friend, colleague, someone in my team, how do I ask them if they have a mental health issue?
Okay, well, if it's at work, this is where an EAP can come in really useful. If you're at home, then also an EAP can become useful if you've got an EAP. But in the workplace, an EAP is useful because your EAP could offer some managerial consultancy to help with this very issue. Because really, each presentation will be very different and may require a slightly different approach, really. But the most important thing, if you are a manager, for example, I'm taking a bit of your question here, Lucy, not the whole one, because it's a little bit different, but I'll take the managerial one. If you are a manager, the most important thing is to be direct and non-evasive, really. By doing this, you're demonstrating that you've got some confidence, and you're also saying this is normal. By normalising the conversation you're about to have or you're already in, you're already breaking down any feelings of discrimination or stigma that your employee might be fearful or concerned about. You're also saying, I'm not frightened to have this conversation with you. You are sort of breaking down the fears that this employee might be feeling coming to you. So be direct. Be honest. Ask how they are doing and tell them what changes you've noticed. You can say, I've noticed that you've been coming late to work and you look quite tired. I've noticed that you're not being as talkative as you normally are. I've noticed that you haven't come to the team drinks for the last two or three occasions, and I'm worried about you. Be honest. Make sure you're in a private room. Don't do this in the middle of an open plan office. Okay, that's another really important tip. And also tell them that the conversation is private. That's also really important as well. And ask them if there are any support you can offer as their manager. What do they need? And ask as well if they're getting any help. Is help necessary? Are they already in some sort of treatment? Have they got some other sort of problem that isn't psychological in nature? Have they got a problem with their health, etc.? You've got to remember, because there could be 101 things going on for this person, never ever assume. And they also may never be willing to talk to you about it. If they're not, it's still no harm for you to recommend some source of support to them. Explain that you're worried, that you're concerned, you've noticed these things, and you'd like their permission, if you like, to keep an eye on them, to ask them how they're doing, to monitor how they're doing, and would they allow that? But clearly, if you are really concerned, and there might be a safety-sensitive issue, in the workplace, due to work, you may be in a safety-sensitive situation in the workplace, or you may be concerned that there is sufficient evidence that they may not be looking after themselves sufficiently, or may be at risk of harming themselves, or even harming someone else. And then you may need to escalate that conversation, but obviously you need to tell them that's what you're doing. But again, I can't say it loud enough, and the EAP is really useful for these difficult conversations.
Yeah. Thank you, Mark. So following on from that then, what should I do as a manager if the employee tells me that they have depression?
Okay. Well, thank them for telling you, to be honest with you, that they've been brave enough to come along and talk to you. Again, explain that the conversation, the conversation, the fact that they've told you will remain confidential between you both. Again, unless there's some impact due to a dangerous situation either in the workplace or at home. Again, ask them what support they might need at work, and if anything is happening in the workplace that's making their problems worse or causing them to feel low and depressed. Is there anything that's going on at work that's having a major impact on their mood? Ask them what support and treatment they're getting, and if any treatment they're having, any medication they're having, for example, will have any impact on work. Some medications for mental health problems can make people feel more sleepy in the morning, for example. Might make people feel a little bit dissociated, so they may feel a little bit vague. it's important for the workplace to perhaps know about that, so that can be accommodated. Again, offer to refer them to the EAP or occupational health or other source of support if you have it, if they haven't done that already. If they haven't done that already and would like to access that support, then make it possible. Don't say, oh, go and make a call from your desk. Give them your office. Give them a quiet space in order for them to make that contact should they need it. Ask them if there's any changes that might need to happen at work that they find helpful. Again, if the business can allow that, and that might again mean changes to working pattern. It may mean change to where they're sitting in the office, for example, if they're particularly affected by seasonal variation, seasonal affective disorder. Maybe it's more important for them to get some natural light and sit near the window. Just for an example, there may be 101 different things that might need to change. Ask them if anyone else knows at work, who they're told, who's giving them most support, who's helping them. It might be nice for them to have some more time with that individual, work more close to that individual if they're particularly supportive and if the business can allow that. Offer yourself as a source of support. And if you're finding it particularly difficult, you get some support for yourself as well. It's really important, I've just said that, and I think I've got to carry on that bit of the conversation, actually, because you as a line manager, you may be faced with some very difficult conversations, and you may hear some very difficult things that your team are experiencing. Again, I say this again, your employee assistance program is really, really useful here to explore your own feelings about your employee's state of health, but also to get some coaching on how best to have conversations and be a really supportive manager. Remember, you're not a psychologist here. You are a manager, and your role is to support, but get the help you need yourself. A really, really important professional obligation that you have to make sure that you're able to have these conversations with your people. But I can't, again, I do say this quite a lot. Never assume. Always ask your employee what will help them. Never assume you know what's going to help them. Always ask them what support they're getting and what support they need. This will also, which is really important if they're having some kind of mental health crisis or mental health problem, it'll help them feel in control and will feel empowered if they have the opportunity to tell you what they need rather than being told what they need. And I think that's really, really important.
Great, thank you. We've mentioned quite a lot of terminology today. What does bipolar mean?
All right. Okay, well, I think I mentioned it when I talked about some of the mental health problems or some of the things that represent a mental health condition, if you like. And bipolar was known in the past as manic depression. And it's someone that affects someone's moods, and it means they can swing really from one extreme to another. So if someone has bipolar disorder, they have periods of episodes of depression where they might feel low and they might feel lethargic, but they also have episodes of mania where they might feel high and overactive, okay, or what we call hypomanic. The actual symptoms depend on which mood is being experienced. Unlike a simple mood swing, each extreme episode of bipolar disorder can last for several weeks or even longer. And some people don't ever experience normal mood very, very often. So no mood in the middle. They're either low or they're high. The depression bit, or the depressed phase of bipolar, is usually the first episode to demonstrate that someone's getting a mental health disorder, if you like. And this, as I've discussed already, someone may experience overwhelming feelings of worthlessness, which can potentially lead to suicide. So there can be quite a serious primary episode of depression. The mania, or during the manic phase of bipolar disorder, which normally follows the first episode of depression, people feel very happy and have lots of ambitious plans, some of these ambitious plans are quite wild, and ideas. They can spend large amounts of money on things they can't afford and would not normally even consider buying, or what they normally want even. They may feel like not eating or not sleeping. They might talk really, really quickly and become annoyed easily. And these are all common characteristics from someone who's in a manic phase of bipolar disorder. During the manic phase, people might feel really creative and view their manic phase as quite a positive side. I treat people who say, oh, gosh, I can't wait for this episode of depression to end so I can get manic again, because it's preferable. But also, during the manic phase, it's not a rosier alternative by any stretch of the imagination, because people can also become psychotic. And I know I'm throwing another word in here, but where people experience psychosis, it's where they're likely or can become quite paranoid, can hear things or see things that aren't actually there, and feel that they can be led by voices, visions, and feelings that they normally wouldn't be. So actually, a manic phase in extreme can also be very, very frightening. However, there is very good treatment for bipolar depressive disorder. It's really about accurate diagnosis, and this diagnosis needs to be made by a professionally qualified clinician. And the treatment will always normally involve some medication and also some talking therapy as well to complement each other. And the common medications that you might have even heard of, lithium, for example, is a common drug used in bipolar disorder, for example.
Okay, thank you, Mark. I want to just try and get in a few more questions.
Okay, we've got time.
Yeah, so is it possible to gain a qualification in counselling at work? We have plenty of first aiders, but they can't help when someone is hysterically crying for no apparent reason. Okay,
that's great, because I mentioned earlier about all the first aiders we have, and yet we don't have anyone to actually be mental health first aiders. I'm not doing a plug here, but we do actually do a training course to train mental health first aiders in organisations for exactly that reason, to be the go-to person, really to direct people to the correct source of support that they might need, but also to be a bit of a shoulder if someone needs to talk to someone about an experience that they've had. Now, the first part of that question was about, is it possible to gain, that's two questions in one here, isn't it? Is it possible to get a qualification in counselling at work specifically? Okay. Most people, the normal way that people will qualify as a counsellor is to do an accredited counselling qualification and then specialise in counselling at work. So I wouldn't direct anyone to a specific course, but I would direct anyone who is interested in training as a counsellor and then specialising in workplace counselling to go to the BACP website, because that has a full list of all accredited courses. And they'll have the most up-to-date list of any courses that specifically, if you like, specialise in counselling in the context of the workplace. But if any organisation is interested in having some short training to help people become more aware of psychological issues in the workplace, then we do provide a one-day course in psychological first aid for people in the workplace. And we'd be very happy to roll it out to anyone who's interested.
Thank you, Mark.
Any more?
Let's try and get in one more question then.
Okay.
So to finish off, how can line managers promote and support good mental wellbeing behaviours?
Oh, okay. I think I probably mentioned this before, so I'm going to have to sort of repeat myself a little bit, I'm afraid. Line managers can actively promote all of the supports that are available in any organisation that they work with and give their teams the necessary resource to access them. So that might mean time It might mean a quiet space, it might mean a telephone, or it might mean a computer. And that means they can then access support services as provided by their EAP. They can access online material that we've already talked about today. They can attend webinars like we're having today. They can log on to live web chats, which I'm doing this afternoon, specifically to get tailored information and support on the problems they're experiencing. Demonstrate human care and empathy. We can all do that. Ask your people how they are. Notice them. If you're concerned, get help. Don't brush your concerns under the carpet. Address them, because by addressing them, you're already breaking down some of that fear and stigma. They'll only get worse if you don't address them. Your staff, I suppose, are your greatest asset, but also, I always say, your greatest risk. Mitigate those risks by doing all you can to support their well-being. And if in doubt, get help and get some support. I've said this as well, I've said it before, but I'll say it again. As a manager, regulate and notice your own mental well-being. If not, it's more important than any other responsibility that you might have. Your own health is really, really important. It's vital. Be consistent and congruent in your own behaviour. If you believe in good life-work balance, which I hope we all do to a degree, don't send emails before 8 a.m. or after 7 p.m. You're then modelling, if you like, what you're trying not to promote. You're modelling the unhealthy behaviour. Support your teams to have lunch breaks. Take regular holidays. Ask about their welfare. Encourage your people to use the services on offer. Go yourself to the wellbeing seminars that are arranged. I don't want to sound really cliche, but I'm going to anyway. Lead by example and walk the talk. You know, we all have the opportunity to change the stigma, to change the discrimination. Today is the time to talk. And hopefully, how many questions have we had?
Oh, lots and lots.
Okay, well, that's lots and lots.
Contributed a lot of conversation.
Of all of those million conversations that are happening today. But go out today and talk to your teams, talk to your family about mental health. Let's kill the discrimination. Thank you all.
Thank you, Mark. Becky, do you have anything to add to that around promoting mental health issues?
Just really to reiterate what Mark has said already in terms of there's a huge amount of resources available to organisations to promote mental health in the workplace. So obviously the Time to Change website, specifically the Time to Talk page at the moment, has a huge amount of resources that you can download and use. You'll find similar information on Mind. You'll also find lots of information on the AXA PPP healthcare website. If you go on there and have a look in the health info section, you'll find a whole host of information and also a link to join Mark's live web chat this afternoon, which any individuals can join and ask any personal questions that they have. As Mark alluded to earlier, we also have a Stronger Minds campaign. So if anyone's interested in getting hold of those, which includes a range of fact sheets and posters to promote a whole range of mental health issues from worrying to getting a better night's sleep, then do please get in touch with us. We'd be really pleased to hear from you. Just to say as well, just to fit in one final question, we have had someone ask if we can provide web addresses for some of the places that Mark's alluded to earlier, specifically things like Sleepio. The Sleepio website, if you go and Google and go to www.sleepio, which is sleepio.com, you'll find everything that you need to know on there. And what we will do tomorrow is to send an email to everyone who registered today, and we'll list out all of those websites for you just to make it really easy. So I think if anyone does have any other questions, and if we haven't had time to answer any, we will be in touch with you. Please do continue to use the form on the left-hand side of the page if you do have any questions. Just to say thank you very much, Mark. Thank you, Lucy. Thank you, everyone, for joining us.
Thank you.